the title of this talk, I'm a board certified internist and a board certified cardiologist. I'm a fellow of the American College of Preventive Medicine, and so on and so on. So what I'm really trying to say is not brag. I'm trying to tell you a little bit about my background and credentials. This talk was originally given with Bill Spear, as you can see his name. Bill is the person who taught me macrobiotics. He now, like me, he's had a brain transplant. I used to be Bob Silverstein, and then I became Robert Silverstein. He used to be Bill Spear, and then he became William Spear. So just be sure that if you talk to him, if you're an old acquaintance, you can call him Bill. If you're a new acquaintance, you have to call him William. So we gave this talk to my hospital. I'm in Hartford, Connecticut. I'm at St. Francis Hospital. We gave it to the Department of Medicine, and it's been updated since we did give it. The reason I chose this slide is because it's kind of catchy, but I'm less interested in where do we go from here to the questions on the right. How do diseases occur, and/or why do diseases occur? Well, I'm going to go through that. Now, let's see. How do we get to next? All right. So this is the concept, the simultaneous prevention of multiple diseases. Here is a case history. At age 30, this person had a high cholesterol of 225, a low good cholesterol, the HDL, of only 40. Triglycerides were 225. And all of these numbers were exactly average for a heart attack. And interestingly, both his parents eventually did have open heart surgery for hardening of the arteries. At age 40, after he'd become macrobiotic, changed his diet considerably, developed more exercise, reduced his weight, cholesterol naturally fell to 130, triglycerides to 80, and as a result, he essentially cleared his future risk of developing a heart attack. Blood pressure, diabetes tests, kidney tests were all fine at that point. Now going on. This is a crucial slide because it really explains the whole idea. Francis Collins was head of the National Institutes of Health during the coronavirus. His main research was HIV, and he was an internationally famous physician. He made this statement: genes load the gun, lifestyle pulls the trigger. Well, the way I explain that to my patients and to you is how much sunbathing should an albino do? Well, now, what's the point? The point is an albino has zero protection in their skin from getting sunburned after any significant, meaning a few minutes, of direct sun exposure. An albino is fine to walk down the street. If it's a hot summer, they probably ought to be wearing a hat. But to go lay down in a bathing suit at the beach is going to get them seriously burned and in trouble. The point being that people have genetic sensitivities, but if they don't anger those genetic sensitivities, then diseases occur. So this was beautifully written up by Sarah Hull, who's at Yale, and published in the Journal of American College of Cardiology, the cardio-oncology version. That's a separate, that journal has 4 or 5 different varieties, and this one is about heart and cancer relationship. And she had diet and the prevention of cardiovascular disease and cancer. And she just absolutely nails the concept of that I'm going to present and that she found to be the case. So to speak, for a short phrase, be macrobiotic, essentially. This is a study that also supports the very same idea. It was called the Cartagene study, and what let's see, who is it? Koch, I think, is the author here. Yeah, Caroline Koch. She published this, and basically it says the same thing, that if you don't anger your genes, you don't get any problem. And what it pointed out was if you have high cholesterol or high blood pressure or diabetes or etc., uh, it's because you have the genetic tendency, but it's what you do that causes the expression of that. And I wrote off to the side there, as you can read, it's not your genes, it's the diet angering the genes. No, oh, there we go. And this is really where the world, most of the world, not so much the macrobiotic world, but the rest of the world is. More and more people do not feel the need to control themselves. This is excess permissiveness, and it's because of what's called dopamine hijacking. Dopamine is one of the reward chemicals in the brain. And so all the things we quote like, close quote, uh, sort of go through that dopamine, serotonin, norepinephrine pathway. And what happens is it gets turned on and over turned on. For instance, what is it the new Ozempic and Mounjaro or Wegovy or tirzepatide do? And what they do is they knock out the interest in food. They do a bunch of other things, but that's their main benefit. They calm that drive to eat. But what happens when they stop? Well, things go right back to where they were originally. There is the return of ravenous hunger and the resurgence of food noise. Food noise means all those cues and responses that cause us to do something. When a person walks into a grocery store, they automatically head here and there and pick up this and that. And as a result, they go home with a bunch of things that are actually counterproductive. So what I'm trying to say is that these habits we have are not just so-called quote habits. They are actual addictions, habit patterns. This was said to me by a very close friend of mine. Unfortunately, pills and surgery are easier for short-term results, which pleases physicians and patients. Everybody wants a quick fix rather than take the hard road, that hard road being essentially macrobiotics or in that direction of essentially ideally organic and unprocessed whole foods vegan at the 85+% level. It takes the hard road of risk reduction. It also gives patients and physicians the absolution that they're looking for. So there's no guilt involved when they recommend medications and surgery. There is a time and place for everything. One of the examples, again, that I tell my patients is if you come to the emergency room with appendicitis, do you want me to call the acupuncturist or the surgeon who's going to assault and stab you? And the answer is, you need your appendix out. That actually is changing a little bit. They're now treating it with antibiotics sometimes. But the point being is that the surgeon will, in a certain sense, accost you. Preventable, if not curable. Stop diseases before they can't be stopped. That's the goal. That's sort of what macrobiotics, that's sort of what being, I used the phrase before, 85+% ideally organic and unprocessed whole foods vegan does. Genes interact with choices, decisions, actions by patients causing made to happen diseases, such as 95% of hardening of the arteries, heart attack, stroke, angioplasty, stents, diabetes, high blood pressure, high cholesterol and triglycerides. All those things tend to be 95% preventable and even largely reversible when they do occur by being essentially macrobiotic, doing exercise, low percent body fat. Finally, the tough love message, it wasn't done to you, it was done by you. Now, the original title of this talk was called Good Cop, Bad Cop. And Bill was the good cop and I was the bad cop because I said what I'm about to say now. Empathy for the patient has actually gone rogue. We are much too supportive and not demanding enough. And you may say, wait a minute. Well, Kevin Volpe of the University of Pennsylvania pointed out, He did studies where there was what's called the carrot and stick approach. The carrot being very gentle with the patient, the stick being a little bit firm and demanding on the patient. And what turns out when you were trying to achieve the relevant goal, being stern and forceful was twice as effective as being kind and supportive. People need that straightforward message. You may not be able to tell, but I refer to myself as a bull in a china shop. I'm very straightforward. I even swear a little sometimes. I am at the level of my patients. If they say something, I will say similar words. But one of my abilities is communication skills to people one at a time. I don't know how I'm doing in this talk, but one at a time, I'm actually pretty good. So I speak straightforward. I'm not overly sympathetic. I'm kind in the sense that I change my tone and so on. But basically, it gets down to simple fact. Do you want it? Don't you? You don't want it? Then quit asking for it. Now, this proves a point about diabetes. This graph, the risk goes up on the left-hand side, and the blood sugar level is on the right-hand side. There are three numbers here. Fasting sugar of 95. If you give a patient a sugar load and measure their sugar at 1 hour, if it comes back 155, or if you measure it at 2 hours, and that's sort of what's on the inside of the slide right here, 2 hours, 83. When you have these numbers, you have no future risk for developing heart disease relevant to your blood sugar. That has to do with whether you're diabetic or not diabetic. But what if it comes back 90 or 126 or 180? Then your risk for heart attack starts to increase. So the key concept is you need these numbers: fasting of 95, sugar challenge, blood sugar 155 at 1 hour, and 2 hours, your sugar should be back down to 83. That is nowhere near the current guidelines. That's one thing about me. I have a kind of hard time explaining it, but I tell patients I'm different. And then I say, but every doctor says that. I'm different too. They're all different. Well, I'm not very much in tune with a lot of the guidelines going on. Now, this is just sort of a quick demonstration. We're going to go over it later on. But what this shows is a blood vessel. This red wall on the outside is the outside of the blood vessel. And this is the lumen, that's where the blood flows. And then this is the inside lining, which is supposed to go all the way around here and not have this cholesterol and calcified plaque and activated monocyte in here, which is activated by these things over here. And this talks about reversal of that hardening of the arteries that's in that. If you get the cholesterol low enough, that cholesterol plaque begins to resolve and go away. But you have to get the cholesterol nice and low. My macrobiotic patients all achieve this naturally, as did the original slide. Now, this is a powerful list. This is a list of goal numbers that when you achieve these, you are essentially, not guaranteed absolutely, that never happens. You are essentially guaranteed of not developing diabetes, high blood pressure, high cholesterol, high triglycerides, cancer of the breast, uterus, colon, prostate, diverticulitis, et cetera, et cetera, et cetera. These are the numbers where risk regresses to zero, which I just told you about. Here, AI gave me a little help and neatened that up so that it's much more legible. And the truth of the matter is, if you take the total cholesterol, subtract the good cholesterol, that leaves you with all of the bad. That number has to be 90 or less. We're going to talk more about that. Triglycerides, which are inflammatory in and of themselves, need to be 100 or less. The A1C diabetes test should actually be in the 4s for almost everyone at every point. But I'm not demanding 100%. One of the things I say to my patients is, you want a cigar on your birthday? You want a bacon cheeseburger on July 4th? Have it. The body will tolerate what you should not do once in a great while. But you have to be careful with Pandora's box. When you start those kinds of things, you can end up getting into the pattern. They are attractive. I have a handout on my website. By the way, the website is down here. You can't read that. It's, well, there it is, www.thepmc.org. And one essay is why I disagree with macrobiotics. And in that one, I basically use that to just catch attention. I don't disagree with macrobiotics except when it's done too rigidly. That's important. Be careful. Don't be rigid. The other essay, there are a gazillion essays on that website. The other essay is called I Don't Like Brown Rice, Vegetables, and Beans. And the very next sentence is, that's a true statement. I don't like them. Now, I'm playing a little bit of a word game. I'm sort of like an attorney by choosing my words carefully. And what I go on to say is, I'd rather have chicken tenders, French fries, pizza, steak, etc. I've had those things my life. And I will tell you, here's a joke that I tell patients. In my life, I've had 3 phenomenal vegan meals. Just knock your socks off, delicious, tasty. And where's the joke part? The joke part is only 3. And that's because I'm kind of a crappy cook. And most people are okay and good cooks, but really knock your socks off is pretty hard to come by unless you're eating steaks and French fries and chicken tenders and pizza and so on. Those things, we're drawn to what we should not. We're back to that reward chemical. Why do you think so much ultra-processed food, that new term that's out there now, why do you think that people consume between 50 and 75% ultra-processed foods? And I mentioned it before. Serotonin, norepinephrine, dopamine, those things get hijacked by those foods, and they are the reward chemicals that say, more, more. And when my patients tell me, but I like chicken, imagine this. I gave this talk in a Black Baptist church, and when I said chicken was your worst enemy with regard to overweight, oh my goodness, there was a laughing uproar. But the point being is we're drawn to what we should not, and it takes a degree of bravery. I read this essay 100 years ago. I think it was in the East-West Journal with Thich Nhat Hanh. I'm not sure I'm pronouncing his name right. And as I recall, I'm probably making this up, but this is what I recall. As I recall, he was asked, what is macrobiotics? And again, what I recall is that it's he said bravery. And I think that's what it takes a degree of. Now, you can get in the habit of being macrobiotic. Brown rice, vegetables, beans, fruit, nuts, and seeds, wild caught fish, rarely, miso soup, sea plants, sea vegetables, and certain cooking techniques and so on. You obviously know what macrobiotics is. So anyhow, so this list of numbers is literally how to prevent diseases, how to prevent that list of diseases that I've given to you a million times. One that is particularly interesting is magnesium. When my patients come in with magnesium of 2.1 or higher, if they don't have kidney disease, then I know that their diet is essentially what you would be satisfied with in terms of health. In other words, essentially 85+% organic, unprocessed, whole foods vegan. And by the way, when I talk about vegan, I point out that Dunkin' Donuts and Wonder Bread are both vegan. That doesn't mean I recommend everything that's vegan. That means that I recommend being ideally organic and unprocessed whole foods vegan. And even that is not 100%. But what's my point? My point is that people who are eating fish, chicken, turkey, meat, cheese, and eggs, and the standard diet will have a magnesium of under 2.1. The macrobiotic people come in closer to 2.4. And the potassium will be lower in people who are heavy meat eaters. So 4.1 is sort of the bottom line. Recently, vitamin D level. Now, macrobiotic people are like ordinary people when it comes to vitamin D. I recommend to my patients 5,000 units of vitamin D3 5 days a week for the rest of your life. Now, you do have to get a level check periodically to see that you don't overdo it. As a matter of fact, most patients who have very low levels, when I check it, 15, 20, 30, I tell them to take it every day for a year. All right, enough of that. This is also kind of interesting for people who overweight. Keep a food diary, eat grains, vegetables, beans. The food mantra, we've sort of talked about that: fresh, whole, and unprocessed, ideally organic foods. If you're overweight, then eat more cooked vegetables. In general, eat out of a bowl because we eat the wrong things off of a plate. There used to be a store in Glastonbury, a suburb of Hartford, that I loved the name of. They sold only animal protein. They only sold fish, chicken, turkey, meat, cheese, and eggs. And what I loved about it was exactly where the world is. And the name of the store was Center of the Plate. The absolute wrong idea that we're having fish tonight, we're having chicken tonight, we're having turkey tonight, and we're having burgers tonight, and we're having pizza this evening. Let's see, aerobic interval training. That's a good one. Recently, I've become more fascinated in recommending Tai Chi more so than almost anything else. There are many techniques to help stop smoking, limit alcohol to 4 drinks a week or less. Reality, stay in reality. If There are 5 basic activities. I think I passed over those: breathing, drinking, eating, exercise, and unrealistic expectations. Unrealistic expectations is about not accepting the difficulties of the world for what it is with great humility and perseverance. The fact of the matter is, if you do that, you'll still have troubles in your life and you may not reach joy, but you won't be anxious or depressed anymore. You will accept your humble position within the universe. All right, now I think I showed this to you before. Basically, what it says is 204 countries in the world, all the countries in the world were studied. And what they calculated, what they found was there were 1 million deaths in the study, and 2/3 of them were due to heart disease and due to diet. Next came smoking, but diet is number one. That study was Emmanuel Castillo, published in Lancet just this past month. And why do I have Sutton's Law here? Do you know what Sutton's Law is? When asked why he robbed banks, Willie Sutton, the bank robber, said, that's where the money is. Well, the money is in diet primarily. There was also the Global Cardiovascular Risk Consortium, which is where this graph came from. It was published in the New England Journal of Medicine in March of this year. This is what happens to the bowel when the wrong diet comes. This is a great mixture variety of the normal, what's called microbiome that lives in our intestines: bacteria, fungi. I was kind of surprised. I only recently found out that there were fungi and viruses inside the bowel that belong there. And what happens is, we do absorb water and food and so on. So there are things that get through this layer, pass through these cells and into the bloodstream. Well, good guys send in good things, and bad guys, there's much less variety. Bad guys send in these toxic things. It dissolves that mucus protective layer, and this activates inflammation within the body. It also increases the risk of cancer. The better your diet when you're on cancer and when you have cancer and cancer chemotherapy, the better response you get from your slowing your disease process. And obviously, everybody in macrobiotics is aware that some patients have reversed their cancers, cleared them completely by simply going macrobiotic. I think Steve Jobs had cancer of the pancreas and he went macrobiotic. Not every disease can be defeated by macrobiotics. He died of cancer of the pancreas despite being macrobiotic. So Ghana, here is the food of Ghana. 80% unprocessed whole foods carbohydrate. They have the lowest cholesterol intake, lowest saturated fat intake, and key story here, lowest inflammation. This was published in Nature Medicine in, what does it say, January? No, that says, yeah, it says January of 2025 by Godfrey Temba. And you can see what these people look like, which is the goal. Now we're getting to the real deal. These pre-technological citizens, indigenous people, natives, call them what you will, they do not have access to our technology, and they also don't have any of our diseases. This was originally discovered by Dennis Burkitt, a Scottish physician who went to Africa. I don't remember exactly what he was there studying. He ended up getting a cancer named after him. It's called Burkitt's lymphoma. But he looked at these people and saw they had none of our diseases. They also demonstrate a key developmental point that if you want to have the lowest percent body fat, then you need a combination of diet and exercise. And this is abdominal clear lines of definition and demarcation. That is a phrase that you should learn, CLOD/D. And there are people in our culture who achieve that. I didn't say these people had great diets. I said physically they are exactly the model that we should all be following. These people, these indigenous groups, this is from Central or South America, this is from Borneo or Java, are exercising 80+% of the day. And this is the blood cholesterol levels of that population. This is the African population, the Kung, the San, the Pygmy, all total cholesterol of 90 to 130, as I've said all along. The same as wild primates, chimpanzees, gorillas, baboons, the same as horses, cows, goats. But here's your average American out here at over 200, which is why we have the average American disease. And this shows, this curve over here that slopes down shows a decreasing incidence of heart disease as you lower the cholesterol. This is in the walking well, and this is in people who've already had a heart attack. These people need to get to a non-HDL cholesterol, take the total cholesterol, subtract the good cholesterol. That's all of the bad cholesterol, and that's called non-HDL cholesterol. A non-HDL cholesterol of 90, as I showed you on that table. People who've already had a stent, angioplasty, hardening of the arteries, they need to get their non-HDL cholesterol down to 75. Non-HDL cholesterol, there are three types of bad cholesterol. There's LDL that everybody talks about, there's IDL and VLDL. So when you take the good cholesterol away from the total, you get all three. Most people only talk about LDL when I am talking about, and other people do too, talk about non-HDL cholesterol. And here we are back at this hardening the arteries slide, cholesterol deposits, calcifications, all because these fellows over here, monocytes that become activated. Activated means they're angry. And why are they angry? They are angry because of people's diet and their blood sugar level, and also the ingestion of food that results in a chemical formation in the abdomen, in the intestine, called trimethylamino N oxide, heme iron, as in steak and hamburger, saturated fat, as in palm oil, which is in so many processed food. And one point that I want to make about heart attack is
I'm sorry to interrupt. There is just a question. What does COOD dash D?
No, CLOD/D, clear lines of definition and demarcation. That's the being able to see where the muscles meet the muscles on the abdomen. If you don't have that, then you have, it's a high goal, but it's something to work towards. It's the lowest possible body fat content on the abdomen. Fat is like a little furnace. It starts sending all kinds of bad chemicals into the blood that activate these monocytes. So going on, 1/3 of heart attacks, myocardial infarctions, occur in people who are in the lowest risk group, whereas no heart attacks occur in the patients who have the numbers that I've given you so far, that non-HDL cholesterol, the triglyceride, the A1C, and so on and so on. Now, this is a picture of actual hardening of the arteries. This is a high-level CAT scan called photon counting. This is a coronary calcium score, and it shows calcifications within the blood vessels that this one does not narrow the blood vessel. It's actually on the outside. But this one over here, which doesn't seem nearly as big as this one, is actually narrowing the blood flow. And it's much clearer than the usual form of CAT scan of the heart. In my patients who have, and this is where clinical judgment comes in, one of my statements is doctors guess at every step, and the best doctors have the best guessing rate. That's what all clinical judgment is. It's like you guess. And when I guess, when I put together in my head, there are calculators for risk, but I just told you the risk calculator doesn't work well because 1/3 of people with heart attack are in the lowest risk category. But the key here is, by the way, about 30 or 40% of people who have high risk, they have high blood pressure, they have high cholesterol, they have high triglycerides, they may be diabetic, have perfectly normal coronary arteries. So just because you have those risk factors does not automatically mean their blood vessels look like this portion down here, entirely normal. And it turns out if you just take a random group of people, they did that at a hospital. They took the employees, gave them CAT scans. 50% of them had hardening of the arteries. Well, 50% of them didn't, but 50% of them did, and they were all asymptomatic. They weren't walking around with heart failure or angina, shortness of breath, and so on. And here we are again talking. Now, this is an LDL test, but this translates as a non-HDL cholesterol of 75, but it's an LDL of 55 to 65. All the cardiologists now will tell people who've had an angioplasty or a stent or open heart surgery, you got to get your LDL down to 55. I think that's the wrong way of looking at it, but on the other hand, that's how these two powerful studies were done, using a class of medications to get cholesterol down called PCSK9. And Praluent, Repatha, that's their commercial names. And you get the cholesterol very, very low. And what happens is you begin to leach that cholesterol. Let's go back. Oops. Can't. Oh. You begin, this yellow stuff begins to diffuse out of here, and this plaque shrinks down. So that's what that curve showed. Now, this is intended as a little break here. So the patient says, should I eat more vegetables? And the doctor says, let's not jump to conclusions. Here are some pills. Most doctors, when you go to them, they'll ask you what your problem is, and then they'll give you a prescription or refer you for physical therapy, or you need surgery of some kind. That's a really nasty accusation, but that is the way medicine works now. And we're back to Sutton's law about diet being number one, published in the New England Journal of Medicine, the Global Cardiovascular Risk Consortium that studied that showed most deaths were due to heart disease, which was due to diet. And this shows an improved risk on a more vegetarian Mediterranean diet. It's called the Vegetarian diet. There has been a great misinterpretation of the Mediterranean diet. It is not as effective as it is being cracked up to be. I get in arguments with people about this, but as I recall, the only thing that was really reduced was stroke. And yes, because you reduced stroke, you did reduce overall mortality. But as I recall, it did not have that much effect on heart attack and so on. So the point being is, if you want the best, then be macrobiotic, which is, so to speak, grains, vegetables, beans, fruit, nuts, and seeds in their ideally organic and unprocessed form. This is another study that says exactly the same thing. A bunch of people were studied in England, the United States, and China. And what was found out is those people who did grains, vegetables, beans, et cetera, drank little tea and coffee versus those who had the center of the plate animal-based food intake, as well as the refined grains plus potatoes. Potatoes is one of the things that I have a hard time explaining since it's a vegetable. For the body handles potatoes like it handles a candy bar. So the carbohydrate in potatoes comes in. Now, what if you don't eat potatoes that often? No big deal. Again, as I've said, I'm not against anything. Anyhow, those people who were on, so to speak, the standard diet had a 32% increased risk of cardiovascular disease and cancer. And those people who had grains, vegetables, beans in the unprocessed had a 32%. Maybe I got those numbers turned around. Bottom line was there was a 52% difference. And this is just another study that shows how it literally affects the heart function as measured by a cardiac ultrasound called an echo. And this is what food actually does. Saturated fat from meat and cheese comes into the cell and destroys these GLUT4 receptors where insulin is trying to get into the cell. And as a result, the glucose, which is over here, can't get metabolized appropriately. Food is not just food. It is chemical information. And this is one of the main inflammation pathways. You're going to hear more and more about this. It's starting to turn up in the standard press. It's called mTOR. It's either mechanistic or mammalian target of rapamycin. Target of rapamycin, mTOR. And what it does is it creates insulin resistance. It affects immune function. And what is it that does that? Primarily an amino acid called leucine. When you see those guys who are working out at the gym and they're ripped and massively muscular and they have what are called six-pack abs. In other words, not abdominal clear lines of definition and demarcation, but you literally look down at their abdomen and it looks like a six-pack of beer, big protruding muscles. That's primarily because they're taking branched chain amino acids, of which leucine is the major one. Leucine is in animal protein and activates this mTOR pathway. Vegetable protein contains glycine, where leucine is in animal protein, and that stimulates the health or longevity, house cleaning, DNA repair pathway, as opposed to the programmed death pathway of mTOR activation in animal protein. I think RFK Jr. has done a great job being Secretary of Health or whatever his title is, except I disagree with his position on all this animal protein where he just turned the food pyramid upside down. He did say fewer chemicals and less processed food, and he specifically mentioned vegetables, but he did not mention beans as protein. Now, this is the pathway of abdominal fat. So it's not like you're going to retain this, but the key thought process is abdominal fat puts out all these proteins called cytokines. And because they're made in fat cells, they're called adipokines. Milton Packer wrote this fabulous paper that was just published this past September in the Journal of the American College of Cardiology, in which he showed all these little proteins come out of fat cells. Fat cells are not just sitting there. They are actually very biochemically alive. And so two of them that come out, one of them is angiotensin. And what that one does, there's interleukin 6. I'll show you interleukin 1A, interleukin 1B. C-reactive protein, adiponectin, leptin, chimerin, and many, many more. I just gave you some names so you'd hear them. But what they do is they go through the AT1 receptor, which then releases oxidants. Now, oxidants are, you understand if you took an iron beam, an unpainted iron beam, set it outside, and just let it be in the air, it would eventually rust. That is the perfect way to understand what oxidants do in the human body. They activate this epidermal growth factor receptor, which activates the mTOR pathway, which of course is opposed by the AMP pathway, the health and longevity and survival. But this is the disease pathway, and it starts with not being able to see where the muscles meet the muscles on the abdomen, where that question came up, clear lines of definition and demarcation. Now this, I just mentioned this a minute ago, and what I mentioned was these cytokines over here that increase as body fat increases, as does cholesterol and triglycerides. So the point being is, you don't want these characters around. This is who died when the coronavirus was out there. Actually, Bill Spear told me a story of a family who had a member of a very macrobiotic family who had a member who had caught the coronavirus. And he said none of them masked. They all took care of this patient, and not one of them came down with the coronavirus. So I agree that being macrobiotic vastly increases immune strength. When people have diabetes, they have high glucose, and that glucose aids the coronavirus replication. Overweight from milk and meat with that saturated fat, palmitic acid, which I mentioned before, inhibits the immune function of what's called T-cell PD-1. Abdominal fat, the largest gland in the body, when you can no longer see where the muscles meet the muscle, clear lines of definition and demarcation. Forget the waist-hip ratio, forget the BMI, forget everything else. I've given you the absolute goal: abdominal clear lines of definition and demarcation. Excess angiotensin, excess aldosterone, chimerin, oh, that's misspelled, adiponectin, leptin, FD3, GFD3, and this causes scarring formation, which is in the heart and produces interleukin-6, which drives inflammation. And so on. There are 60 different conditions related to the development of being overweight. This is more about mTOR and AMPK, mTOR being bad, AMPK being good. This is the increasing incidence of diabetes. Once again, here's your vegetarian diet being the most effective way of preventing diabetes. The American Journal of Kidney, the National Kidney Foundation now recommends being essentially vegan. This is the mouth of a carnivore. But carnivores and omnivores, like bears, can safely digest raw, rotten meat. You and I cannot safely digest raw, rotten meat. We have 4 teeth, which have been called canines for tearing meat. That's 4 out of 32. So my position is, at a maximum, if you are trim, that the human body will probably tolerate animal protein 2 to 3 times a week. What size? Your palm for you, my palm for me. Gladiators were 99% vegan vegetarian. They ate animal protein 3 times a year the night before they went into the arena. They were called barley men because barley was their main food, lentil barley soups. In fact, the word burley, which means big and husky, comes from the word barley. Protein is everywhere in a vegan diet. Hey. Oh, oops. Oops. And this says that same thing about foods exactly as they grow up out of the ground and in the field. grains, vegetable, beans at a 7 to 8 to 1 ratio. If you're perfectly trimmed, the human body will tolerate animal protein 5 times in 2 weeks in all probability. Main foods, hulled barley, not pearl barley, brown rice, millet, quinoa, oat groats, not oatmeal, not steel cut oats. Green tea, fermented foods, sauerkrauts, sea plants, wakame, arame, hijiki, kombu. And this is what our food should look like. Remember, I said we should eat out of a bowl. Males need 56 grams a day of protein. If you're a weightlifter or a distance exerciser, you might need 66. Women would be 46 and 56. The average American is eating 100 grams of protein a day. It takes 6 times more energy and 7 times more land to raise a pound of animal protein compared to a pound of vegan protein. And this is what our food should look like. I'm just having a little trouble. Hey, what happened? And this is the truth. This goes back to one of my early slides about not angering your genes. We've met the enemy and he is us. This is that little character is an opossum. He's standing in this forest that the trees are beautiful, but the ground's full of trash. And this was a poster by Walt Kelly during the first Earth Day in 1970. And so it is the unfortunate truth. We have met the enemy and he is us.